Hi everybody, it's Dr. Magnifico from Vet and Pobly.com. This is Remedy. She is a mixed breed dog. She has a history of mast cell tumors, and her owner just noticed a bump on her knee. It's actually kind of the size of a quarter, and it's kind of soft and what we call soft and fluctuant. But I tell people, really a bump doesn't mean anything until you get some of the tissue that's underneath it. So in order to get some idea of what's going on here, we're going to do a cytology. So that's actually putting a needle into the mass and drawing out some cells. Lots of times I can kind of I have sort of a feel for what it is. So a lipoma, which is a fatty tumor, is just going to be soft for me to get sample out. The grittier it is, the more I get worried. Because she's got a history of mast cell tumor, we're going to be a little more aggressive and a little more proactive than we would normally. So I told her today I'm just going to take some cells out of the mass. I'll put it on a slide. I'll look at it here. I am not a pathologist, so I'm very reluctant to make a diagnosis based on a cytology exam. But if it looks like it's something concerning, certainly we will offer her to send it into the lab. A pathologist there will give us some idea, but until you get biopsy, so until you actually get a piece of tissue, everyone is just going to use words like consistent with. So you're not really going to get a diagnosis in many cases with just an aspirate. In most cases, you really need to get a biopsy. Because this dog has a history of mast cell tumor, we're going to be a little more aggressive. So if it looks weird on the slide, we've decided to not send it in. To send it in for cytology is about $200. We're instead just going to take it off. The biopsy is about $200 either. So sometimes it's just managing resources. So if your dog certainly has a questionable history, or you've got lumps or bumps that you're not sure of, talk to your vet about the difference between cytology or aspirate, and then biopsy, and then manage your resources accordingly. It's going to be much more important to get this mass off of this dog than it is to give her an idea of what it looks like. And for dogs with mast cell tumors, really want to get them off as quickly as we can, and we want to be as aggressive as we can. The larger they get, the more difficult it is to take them off completely. If you have any questions, you can find me either at Vet or Pobly.com. Take care. Bye.